School-based healthcare is a powerful tool for achieving health equity among children and adolescents who unjustly experience disparities in outcomes simply because of their race, ethnicity, or family income. It's also a common sense idea gaining currency across the country. Placing critically needed health services directly in schools so that all young people, no matter their zip code, have equal opportunity to learn and grow. At the heart of the model is the partnership between the schools and health agencies that give or support the services offered to students. This video will explore the value, benefits, and supports of building a successful partnership between school and health center.
I'm here at E.L. Haynes High School doing clinical therapy with high school students. I'm a school-based clinical manager within our school-based mental health program. I'm here 2.5 days a week. I typically hold about 6 to 8 therapy sessions per day. Some of the needs that we see the most are depression, anxiety, post-traumatic stress disorder, ADHD, and trauma, a lot of trauma. So our program came about a couple of years ago when we were working at our outpatient mental health clinic, and we were getting tons of referrals for therapy from schools about students they were really concerned about. And they would refer to us, and families would come for an initial intake and then slowly maybe start to miss every other appointment, or in a lot of cases never even made it to intake. And so we put our heads together and thought, rather than waiting for the community to come access a service that they clearly faced all kinds of barriers in accessing, let's try bringing the service to the place where students and families are already spending most of their days. And so we began networking with schools in the area where our clinic was located. We circulated a needs assessment to get a sense of what types of mental health needs do you see in your building. Do you have needs that you feel like aren't met? Would you be interested in having a clinician come part-time or full-time to help support those students and provide on-site therapy? And the response was a resounding yes.
Unofficially, our partnership with Mary Center began in 2012. That was when we had our first Mary Center social worker on site doing school-based therapy. We moved into a formalized partnership in 2013 after we became the recipient of Community Schools Initiative funding. At the time, E.L. Haynes was also moving to develop a comprehensive student wellness support team, and Mary Center's vision of supporting the whole child, of being a medical, a dental, a social service home for a family really resonated with the work that we hope to achieve here at Haynes.
Our clinicians became connected to school personnel. They became the go-to person to talk about mental health issues with children. Teachers began to trust them and ask for consultation on classroom management. Administrators looked to our clinicians to help guide them as to how to manage family issues. They were also looking to us to help them connect families to services in the community, not just mental health services, but community support services.
Successful school health partnerships share a common vision, that of young citizens thriving in the classroom and beyond.
I think one of the biggest successes we've seen is we've really been able to support our parents with finding medical homes for their families. We have a lot of families where there are 2 to 6 children that attend one of our 3 campuses, and it is a beautiful thing to be one school that can support an entire family's education, and then to partner with an agency that can be the home for that same family in all other ways.
Generally, we're finding that because we're in the school and they have access to us, more clients are getting a full episode of care that they never would have been able to get if they were in a traditional outpatient mental health setting.
School settings make visible what is often invisible in traditional community settings.
We went from having 50 mental health visits of E.L. Haynes students per quarter. Now we're up to 500. It really signifies what a huge need there was for mental health care services at the schools that just weren't met.
Because we're often seeing some of just the highest need children in the school. We see that our full-time presence actually does impact more than that. We target at-risk students who might not have yet risen to the level of needing clinical care, which is great. It's what we should be doing. So schools have really recognized that.
But with success come challenges.
One challenge we face is just learning how to speak the language of education. We would come to a team meeting and we'd be talking about our patients and they would be talking about their students. And even though we're just mental health therapists, we have to really care about a student's grades and academics and attendance, or else the partnership's not going to work. And even though an educator might just be an educator or a teacher or an academic counselor, they have to really care about what's going on with that student outside of the classroom or outside the school building, or else it's going to be really hard for that child to succeed.
Change doesn't happen quickly. You have to invest and be patient and allow relationships to form and allow everyone at the school to collaborate.
So that could be principals, it could be behavioral teams, it could be parent advisory committees, but really recognizing that this type of work does require a shift and does require a cohesive vision, and so having all stakeholders at the table is really important.
For schools and health centers interested in starting a partnership, Mary Center and E.L. Haynes have this advice.
I think my first piece of advice is to go to the leadership of the school and find out what that school is about, what makes them tick, what makes them special, what's their vision, find out where the gaps are. We found our niche in mental health. We knew that in DC there were many students in schools suffering from trauma, and it was going untreated. And so mental health was our in, and it was where the gap was in the schools, and we met it.
For schools considering a school health center, one of the most important places to start is with having a staff member that has the designated time to dedicate towards research and building up relationships. Being able to have part of my job dedicated towards collaborating with agencies, identifying new partnerships based on needs that we've seen is really valuable.
The benefits that school health center partnerships make possible are felt community-wide.
I think one of my favorite outcome measurements that we look at is school connectedness. As a result of getting school-based mental health therapy inside of my school and having a trusted person inside of my school, did you feel more connected and welcome and safe in your school? And we hear from students a lot that yes,